Let's talk about wanting to want your partner. So, this video is for women in heterosexual relationships who feel like they've lost their desire, kind of generally, but also for their partner.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Okay. So, wanting to want is a concern I hear from women and have heard for decades. It's a very common concern. It's a common complaint for women in long-term relationships. And they'll say to me that they love their partner, they're really happy in general in their relationship, but they are missing that desire for their partner. They're missing desire, and specifically desire for their partner. So first things to try, of course, are things like hormones, testosterone and estrogen. If you're low on those hormones, they can be really helpful in generating wanting. There are medicines that can be helpful for some women, Vyleesi and Addyi. They can be helpful for men too, actually, but they can be helpful for some women in generating desire. So those things are worth trying. And of course, sex therapists have all kinds of tricks, and you can hear about them. I will talk about them as well. But let's say that you've kind of covered some of that ground already and you're still not feeling that desire that you're looking for. It's not uncommon. So here's the thing. We're primates, we're mammals, and it's really not programmed into our DNA to want the same person for decades. That's just not part of our evolutionary adaptive history. Okay. It's a great idea. We love the idea. And some people feel it, but not everybody. And probably most women in long-term relationships would say they struggle with that experience of wanting to want their partner. So it's pretty typical. Of course, there are things you can do, and that's what we're going to be talking about today. So you might feel like this is bad news, but I don't think of it as bad news. I think about it as recognizing who we are as mammals and as primates and what the sort of laws of nature, the sexual laws are that we have to work with so that we can create the sex lives we really want. So that's what this is about. So that's what this video is about, not sort of sitting around waiting for that desire to happen, but now in a long-term relationship, you may have to make it happen. Okay. And so what does that mean? That means starting to become more aware of the things that turn you on, which may not be so simple because sometimes women feel like they've lost touch with what turns them on, or what used to turn them on doesn't anymore. We'll have a video about that soon. But you've got to figure out what turns you on and then start to feed that to your body in a regular way, like literally every day, a little bit. So, if you've identified some sort of romantic stories that turn you on, then read a little bit every day or listen to audio tapes of them a little bit every day. Not to have an orgasm, but just to remind your body about sex in a sort of exciting, positive way. Maybe watching a little porn every day would do it, or playing with yourself in the shower, a little masturbation. Again, not to have an orgasm, but just to remind your body about sex. So it takes some effort and it takes some time. And certainly working with your partner around what helps sort of generate sexual tension in your relationship, what helps generate sexual energy. But I think the bottom line in this video is to sort of encourage you to put effort into it, that just waiting for it to happen is unlikely to be a productive approach. And, sometimes women will say to me, I don't have the time to think about this and to generate sexual tension for myself. And that may be true. Maybe you're working a lot or focused on parenting and you really don't have the energy and time to do this. That may be reality for your life right now. But hopefully you'll be able to fine tune things in your life so that you can find the energy and find the time to do this kind of work, because tuning into your own sexual energy will probably be exciting for you just as a woman to feel tuned into sex again. It's probably going to feel rewarding, but it's also going to be great for your relationship. And it's going to serve not only your sex life, but your experience of life more generally. So it's time well spent if you can find it. So again, that means doing things like becoming more aware of what turns you on and doing that for yourself regularly to remind your body about sex. Now, during sex, it can be helpful to have practiced mindfulness meditation, because mindfulness meditation teaches you to not tune into your thoughts, but to tune into your body. So during sex, if you've practiced mindfulness in a regular way, like 10 minutes a day, you can use those skills to tune into your body while you're having sex, which can help you feel desire in the moment as well. So mindfulness practice is great for this as well. But I think the bottom line is recognizing that it's going to take effort on your own part. I mean, if we could decide the laws of nature sexually, people would have great sex in their relationship for decades, no problem, and I'd be out of a job, which is clearly not happening. So this is challenging for people. It's just like appetite can be challenging for people. We can't dictate how hungry we are or what our favorite foods are. And desire is like that too. So it's just a part of being a human being. It's a part of being a mammal. And having that desire in a long-term way will likely require effort on your part, just like having the food you like in a regular way requires effort on your part, and things that are worthwhile tend to require effort. So I would suggest, if you think about it in this way, it can help you let go of the struggle and just engage sex in your life in a way that is more productive. So I hope that helps. Ladies, let's talk about how to generate sexual tension with somebody. You want your partner to want you. You feel like your partner's distracted, not really in the game with you sexually, and you want him, then this is something to practice. Or let's say you're dating and you have your eye on somebody and you just don't think they're as attracted to you as you would like them to be. So here's the thing. Opposites attract sexually. I think of it as a law of nature. Opposites would be someone's vulnerable and someone's strong. Okay. Someone brings the openness and the vulnerability, and someone brings the solidness and really the safety so that everyone can have an ecstatic sexual experience. Someone's vulnerable, someone's strong. Now, here's the thing. Guys like both in women. They like vulnerable women, they like strong women, and most guys can play either role. But women are picky. Women like strength in men, but they don't really like sexual vulnerability in men. So like if your guy starts like moaning and like when he has his orgasm, he's like fluids flying everywhere, what are you going to think? You're going to come to my office and say, that was gross, right? But if a guy's with his partner and she's having her orgasm and she's moaning and fluids flying everywhere, he's not coming to my practice. He's having the best sex of his life. You see the difference? So females like strength. Males like that letting go stuff, but they also like strength. They're happy to let go too. But here's what I want you to realize. You want that opposites attracting tension, but that means that you've got to bring the vulnerable, open element to sex. You have no other choice, because if he's bringing it, you're gonna probably get turned off. So you've got to bring it. So what does that mean? Openness and vulnerability isn't weakness. It's a mistake women often make. They say, I don't want to be weak. Well, nobody wants you to be weak. He doesn't want you to be weak either. I tell you what, men talk to me always about appreciating strong women in bed. So I don't know that I've ever had a guy come in and say, I'm just so attracted to weak women. So really, this isn't about being weak. This is about being open. Those are two different things. And you have to be strong to let yourself be open. Okay? So how do you cultivate that for yourself if you're not used to it? Because really we have associated a lot of negative to this concept of female vulnerability. We think of it as women putting themselves out there for the potential to be abused, that sort of stuff. So, of course, there's a dark side to vulnerability. That's not what we're talking about here at all. We're talking about the kind of vulnerability where you're open and accessible and available and in tune with your body. That is a whole different thing than weakness, okay? So how do you cultivate that vulnerability? Because women will often say to me, I've let go of vulnerability. I don't want it. And that's fine, but then probably you're not going to have great sex. That's just unfortunately the truth that for great sex, most women have to let go. They have to be vulnerable. There's probably no great sex for them otherwise. Again, guys have more flexibility in the bedroom than women do with regards to this. So if you want great sex and you're not having it, you've got to cultivate your own process of openness. Okay? So one of the homeworks I often give women in my practice is yogic hip opener poses. If you've ever done yoga, you know what I'm talking about. Hip openers are very exposing postures, but you don't have to do yoga to know about it. You can just Google it and see what a yoga hip opener posture looks like. And then lock yourself in your bedroom and maybe put on some soft music and lay in one of those poses and do that repeatedly and see if you can find the pleasure in that. That's the same kind of openness and connection to your body and vulnerability that will help you find the kind of sex you're looking for. So you can practice it on your own. And I would suggest you do that, because if you're not used to feeling vulnerable and enjoying that on your own, it's going to be that much harder to find that energy when you're with your partner. So you want to practice it on your own first till you can find it and enjoy that sensation. And then just manifest that. When you're with your partner, just bring that sensation into your body and into your movement. So it doesn't have to and shouldn't just happen in the bedroom. Bring it into your relationship, and that'll start that opposites attract sexual tension thing going. You will feel vulnerable. You'll feel exposed. I get that. But for good sex, everybody's got to feel some element of that. I just did a video for guys. Look that up. You can see why that can feel vulnerable to them, because good sex requires showing up. You got to show up. And men have to show up with their strength, and women have to show up with their openness. And everybody, frankly, feels vulnerable doing it, but that's the key to great sex. So let's talk about compulsive sexual behavior disorder. Now, this is a very controversial topic, and there's not a lot of information that I can give you in a brief video, but here are a couple of points. There's a lot of controversy here, okay, because it's a very complex and unique disorder. Unique meaning it's different for everybody, which is part of what makes it so complex. So one point is professionals don't even agree on what to call it. Some people like to call it porn addiction or sex addiction. Some people hate calling it addiction and want to call it, for example, compulsive sexual behavior disorder, or an impulse control disorder, or sexual behavior, sexual dysfunction, not otherwise specified. We professionals have all kinds of diagnostic codes to reflect this kind of behavior. So I think it's important to recognize that the controversy is here. No one's arguing, is this a problem for some people? But people certainly are arguing about what to call it, okay? And another thing that people are arguing about is what defines compulsive or addictive behavior. So how much porn is too much porn? How much sex is too much sex? How much masturbation is too much? And of course, everybody has a different opinion about that. So for example, we have research that shows college men, about 40% of them will masturbate every day. Some people think that's a high number. Some people think that's not a surprise at all. Within that same sample, about 4% of college women masturbated every day. So we tend to see very much tend to see more of this kind of compulsive behavior in men, more in men than in women. But at any rate, the question is, how much is too much? So let's talk about the use of porn. So people use porn when they masturbate. So what we're really talking about is how often people masturbate. Now, there was an interesting study published in 2023 about the popularity of certain websites in the US. And they looked at many websites and really just sort of the numbers of people that looked at those websites regularly. And out of the top 11 websites, 3 were porn. Okay, out of the top 11 websites people went to, the data was probably collected in 2021, maybe 2022. in the top 11 websites that people went to in the US, 3 were porn. So that shows you how popular porn viewing is, which shows you how popular masturbation is. Masturbation is a very popular pastime. Okay. So that, however, leads to one of the controversies of compulsive sexual behavior is how much is too much? When do we call it a problem? And everyone has a different opinion of that. So the bottom line, I think, with people struggling, truly struggling with a compulsive sexual behavior or compulsive porn watching, is it's important to figure out for a professional to diagnose or determine what feeds that compulsive behavior. Okay. And that is different for everybody. So people can engage in compulsive behavior for all kinds of reasons. And for the most part, someone's not going to get relief from that disorder, from that diagnosis, unless it's understood what motivates that behavior in the first place. Okay, so all kinds of things can motivate it. People can be depressed, and that depression can motivate masturbation or sex. So depression can motivate masturbation because it gives people some time out of their heads and sort of out of their sadness and focused on something that feels good to them. Or mania can motivate compulsive behavior because people are manic, and oftentimes sexual behavior is associated with mania. Attention deficit disorder can feed or motivate compulsive behavior because people they need more stimulation. And so they're always looking for ways to stimulate themselves. But other things too, narcissism can promote or kind of feed compulsive sexual behavior. If someone's narcissistic, they don't really focus on other people's feelings, just their own, and they might be more apt to engage in a compulsive behavior. Maybe they have an avoidant personality disorder, meaning that for them it is really scary and uncomfortable to connect intimately with another human being in a kind of like a regular way. So for them, they feel safer having sex with a bunch of different people. Now, I can go on. There's a lot of different sort of issues that can feed compulsive sexual behavior. And often it's a variety of reasons. So it's not uncommon for me as a sex therapist to work with somebody that has a variety of issues that led to a compulsive sexual behavior. So for example, untreated depression. And depression, so in men, depression doesn't have to look like, oh, they're laying on the couch all day and they're crying. I mean, depression can appear in many different ways for men, for everybody really, but we're talking more about men right now. So let's say untreated depression, untreated attention deficit disorder, and then maybe an avoidant personality style, which makes them uncomfortable connecting with another human being. You see, that's very complicated. And oftentimes when I'm working with someone who has a compulsive behavior disorder or a compulsive sexual behavior, I'm working in conjunction with a psychiatrist who's prescribing medication. So we diagnose this person, we understand the complexities leading to this behavior, then they're put on medicine, and I work with them as well. So it's a very it's a complex kind of treatment. It's not like one size fits all. It's not like, oh, you do this and then this is how we treat it. It's complicated. So it's often meds and therapy. We know that folks that engage in more compulsive sexual behavior, they tend to have a higher libido anyway. They tend to see more things as sexual in the environment anyway. So, they would watch a movie and see scenes as sexual that other people may not. So they're kind of in their own way a unique population in some ways. So again, the bottom line here is there's a lot of controversy, but that doesn't mean there isn't very real pain that's associated, emotional and sometimes physical, with compulsive sexual behavior. So it's important to get good treatment. And this video is just sort of explaining why it can be difficult to find good treatment. It's important to find people who have experience with these issues so that you can get, if this is your concern or your loved one's concern, that they can get a solid evaluation and some good help. Today we're going to talk about the sexism inherent in our understanding of male sexual dysfunction. We're developing a better understanding of sexism with regards to sexuality in women, but we're still doing a really poor job with guys. So let's talk about that. I'm going to discuss 3 common sexual dysfunctions and how there's sexism inherent in that. So first of all, erectile dysfunction. Erectile dysfunction affects lots of guys, up to 40% of men across the board. But it affects people more as they age, but there are so many variables that play into erectile dysfunction. We'll talk about that disorder in and of itself in another video. But so erectile dysfunction is a disorder of arousal, meaning that erection is the arousal, it's the effect of the arousal of a man, of a penis. So erection means blood flow to the penis, and that's arousal. So in a woman, arousal is blood flow to the genitals as well, and it's also lubrication in her vagina. So everybody, it demonstrates this kind of sexual arousal in their own way, and for men, it's via their erection. Now, here's the thing. When women have an arousal disorder, meaning they're not lubricating or there's not swelling to their genitals, there's not blood flow to their genitals, what do women do? If they want to still have sex, they get lubrication, and chances are they're still able to have sex even with an arousal disorder. Okay. But if a man has an arousal disorder, that's a whole different thing. If a man has an arousal disorder, he's not getting erect. And even if he wants to have sex, often there's very little, if anything, he can do about it. He can't run to the store and get an over-the-counter medicine that's going to give him an erection, and then suddenly he'll be able to have sex. So if a man has an erectile dysfunction, which is an arousal disorder, he's out of luck. And what do we say to men in these situations? We say, oh, they're so focused on their penis. Well, of course they're focused on their penis, because for a guy, his arousal is necessary in order to have intercourse. But for a woman, her arousal is not. Okay, so that's, in that way, there's sexism inherent in our understanding of erectile dysfunction. Now let's talk about premature ejaculation. So premature ejaculation affects maybe about 25% of guys. So that's pretty common. And that means that within, let's say, 1 to 3 minutes of entering his partner, he has an orgasm, premature ejaculation. Now, if a woman has a quick orgasm, we don't call it premature orgasm in her. In fact, if a woman has a fast orgasm, we're likely to say, wow, she's so sexual. That's so cool. We applaud that in a female. But in a man, what do we say if his orgasm happens fast? We say he doesn't care about his partner's pleasure. We say he's narcissistic. We say he's just so out of touch with his body that he can't tell when he's having an orgasm. All these negative things, right? But we don't lay that kind of burden on a woman at all. So in that way, there's sexism inherent in our understanding of PE for men. And finally, let's talk about delayed ejaculation. So delayed ejaculation means that his orgasm isn't happening, okay? He's erect, but he's not having an orgasm. And this can happen between maybe 5 and 10% of guys. These statistics are variable because it really depends on the researcher, their subject population, how they define these disorders, whatever. But let's say 5 to 10% of men struggle with delayed ejaculation. And so what do we say about that with men? Well, he's probably watching too much porn, he's masturbating too much, whatever. We pick on men for delayed ejaculation. What if a woman has a delayed orgasm? Well, we've come to a much better understanding of the fact that orgasm for women can be complicated for a variety of reasons. Oftentimes, people will kind of make space for that it's more challenging in general for a woman to have an orgasm than a man. Now, that's not perfect, of course. Women still get grief for challenges with orgasm, but nonetheless, we're certainly more apt to give a man grief about that, about not having an orgasm, than we are for women. So, as you can see, there's a lot of sexism inherent in these concepts. And what does that do? That leaves men feeling ashamed, self conscious. It feeds performance anxiety, which means that they're more anxious and their tendency is then to have more kinds of challenges in the bedroom. It's not good for anybody. And men who have these kinds of issues and anxiety around it are more likely then to masturbate rather than to have intercourse. They're likely to watch more porn as a result because it's masturbating isn't going to result in him getting a negative evaluation from a partner. So it doesn't serve him for us to lay this on guys, and it doesn't serve his partner either when we misunderstand a man's sexuality. So this is super important. And here's the thing, kind of like the bottom line in my opinion at this point is sex tech. We're coming back to sex tech again because sex tech is getting so advanced and so powerful that sex tech already can offer men a level of intensity of a sexual experience that most maybe human females or human partners can't provide. So we're now sort of entering an era where we're competing with sex tech for our partner's attention. That's a reality. That's not just a spin. That's a truth now. So if men feel unaccepted about their sexual issues with a human partner, they're just going to be more likely to go to tech. That's not what we want. We want to maintain human connection. It's healthy for people. People get so much out of it. So it's important for all of us to become better partners, more compassionate partners in the bedroom, so we can maintain the benefits of intimacy as well as the benefits of tech. So, hope that's helpful.